Hello everyone. Today we are going to describe about facial nerve, which is a mixed type of nerve that carries both sensory as well as motor information. Facial nerve. It have total 5 components, that is spatial visceral efferent, general visceral efferent, and another are spatial visceral efferent, and last one is general somatic efferent. And we will describe about these components along with their pores, nucleus, and distribution. First of all, we are going through spatial visceral efferent. Its nucleus is present in pons as a motor nucleus of cranial nerve 7. It is present little ventral and downward in pons, and this course has there is abducens nerve nucleus. It surrounds and come out in the posterior medullary junction. I would like to go through another color. Let it do with red color and come out in posterior pontomedullary junction and enters through internal acoustic meatus, comes downward through facial canal and in the medial wall, and then come in posterior wall and come out through stylomastoid foramen. Stylomastoid foramen. This is come out in stylomastoid foramen and then come out, and in the stylomastoid foramen it gives total 3 branches, that is posterior auricular and 2 muscles, that is stylohyoid and another is posterior belly of digastric. Stylohyoid and posterior belly of digastric, and then it comes in the substance of the parotid gland and gives 5 branches, that is temporal, zygomatic, after that buccal, another is marginal mandibular, and last one is cervical branch. For exam point of view, this is enough, and further later we will describe which muscles this nerve supplies. This is about spatial visceral efferent. Okay, then we go through another, that is general visceral efferent. General visceral efferent is also present in pons, and it has also another part, that is lacrimetry nucleus, and from this nucleus fibers come out and in the internal acoustic meatus, and then it gives greater petrosal nerve near the geniculate ganglion. There is like a geniculate ganglion, and there is greater petrosal nerve which come out in the middle cranial fossa through greater petrosal foramen. Okay, and then it comes out through foramen lacerum, and then it enters Vidian canal or pterygoid canal. It along with greater petrosal nerve. This is greater petrosal nerve. Along with it, another fiber also come, that is deep petrosal nerve. It is actually the sympathetic fibers present in internal carotid artery, and this too enters the Vidian canal, and this nerve is called nerve to pterygoid canal or Vidian nerve. And then these nerves come in pterygoid canal, and after that these nerves accompanies with third branch. There is like B1 and B2. The second branch or second, that is maxillary nerves, and this maxillary nerve comes downward in the pterygopalatine fossa, and these postganglionic nerves come with it. This is zygomatic nerve. Postganglionic nerve accompanies the zygomatic nerve, zygomatic branch. This zygomatic branch accompanies and supplies to the lacrimal gland as secretomotor fiber. And another postganglionic branches are, that is actually these postganglionic nerve fibers pass through this supraorbital fissure, okay, along with the zygomatic branch of this maxillary nerve. And its 2 postganglionic fibers are nerve to paranasal sinus and another nerve to mucous gland of nose, soft palate and hard palate. This is about the greater petrosal nerve, and this greater petrosal nerve, another branch also. This was the continuation of general visceral efferent fibers, and these general visceral efferent fibers also comes down and goes out, and this is the petrotympanic fissure, and through this petrotympanic fissure these nerves come out and accompanies the lingual branch of trigeminal nerve and comes to relay in. This is submandibular ganglion and postganglionic fibers supplies to sublingual gland and submandibular gland, and this lingual nerve continues to get general sensation for pain plus temperature from anterior to third of tongue. And another special visceral efferent fibers which carries taste sensation from anterior to third of tongue except circumvallate papillae. This nerve accompanies with lingual nerve and then lip and come in this petrotympanic fissure along with this chorda tympani nerve. This hole is called chorda tympani. Then enters the middle ear and again enters in the facial canal through anterior canaliculi. Sorry, this is posterior canaliculi, and then comes up in the facial canal and relays in the nucleus tractus solitarius. We have done these three components of facial nerve, and another is general visceral efferent fibers. General visceral efferent fibers get originated from the mesencephalic general visceral efferent fibers get originated from the lower part of nucleus tractus solitarius, and that is the fibers which originate from mesencephalic nucleus is general somatic efferent. We will talk about that later. First we are going to talk about general visceral efferent fibers originate from lower two thirds of nucleus tractus solitarius, come in internal acoustic meatus, and then joins the greater petrosal nerve and receives the sensation from these glands and nasal sinus. Another component of it also comes down and then again got out to come in middle ear, and this gets supplied to, that is, submandibular ganglion and relays information of sound and general sensation from sublingual gland, submandibular gland, and also from soft palate, hard palate. We have already told these things in there, and also uvula. This is the course of general visceral efferent. And very last one course is about the general somatic efferent, whose nucleus is present in midbrain, and it carries proprioception. Let me go through another color. Again, it comes in facial canal and follows the facial canal to comes out and carries general somatic sensation, general somatic efferent from the outer part of ear, that is external ear. We have discussed about all these four components of facial nerve. And another important things which may not be, this is enough for your examination, but from the examination point of view it is not so much important, though for the information I am telling you. The temporal branch of facial nerve supplies to frontalis muscles, orbicularis oculi muscles, auricular superioris muscles, auricular inferioris muscles, and intrinsic muscles lateral to auricle. Okay, and this zygomatic branch supplies zygomatic major, zygomatic minor, also supplies to zygomatic minor, zygomatic major, and this buccal branch supplies to buccinator, rhizodius, and orbicularis oris, and this mandibular branch supplies to mentalis muscles, and the cervical branch supplies to platysma. In addition to it, it also supplies depressor levi inferioris, inferior part of ocularis, and another is levator levi superioris. These are the muscles of the facial expression which are supplied by the facial nerve. And this is the about pterygoid canal. I would like to tell you pterygopalatine ganglion is also known as Meckel's ganglion. Meckel's ganglion, sphenopalatine ganglion, and another something called hay fever ganglion. These are the terms related to this pterygopalatine ganglion. Another we were talking about that general somatic afferent. These fibers are communicating branch with vagus nerve, and that communicating branch is called Alderman's nerve. These are for MCQ point of view. And another things I would like to tell you about is that facial nerve is divided into three parts. This is called labyrinthine segment. This is called tympanic segment, and this is called mastoid segment. This is present in posterior wall, this is present in tympanic cavity, and this is present in medial wall. And it have two genu. Genu means bending. This genu, there is bending something called external genu of facial nerve, and there is genu of motor nucleus fiber around the abducens nerve, and this is called internal genu. I hope all the things I've told you is pretty much clear about facial nerves. Now we are going for clinical correlation. Very first one is Ramsay-Hunt syndrome. This is due to the herpes zoster infection in geniculate ganglion. We have discussed about three ganglions. First one in facial nerve, there is geniculate ganglion, another was submandibular ganglion, and another was pterygopalatine ganglion. This ganglion is sensory ganglion, and all the fibers, that was all the sensory or afferent fibers, that is spatial visceral afferent, general visceral afferent, and general somatic afferent, release in this geniculate ganglion as pseudo-unipolar neuron, and its central process goes up and peripheral process goes to supply the respective distribution, and these two are parasympathetic ganglion. So this infection occurs in this geniculate ganglion and leads to lack of lacrimation, salivation, Bell's palsy, that is facial muscle expressions will be lost, and another is hyperacusis due to paralysis of stapedius muscles, which was supplied by spatial visceral efferent fibers. And I have told you that now stapedius is from this spatial visceral efferent, and these are the lesions. These are the complications which will be arise due to infection in or lesion in geniculate ganglion. Another is vesicles in auricle. And loss of taste sensation in anterior two-third of tongue except circumvallate papillae. Okay, this is about Ramsay-Hunt syndrome, and we are going to talk about what happens to the lesion when occurs before geniculate ganglion. There will be lack of lacrimation, lack of salivation, lack of taste sensation, hyperacusis, okay, Bell's palsy. These four symptoms will be occur, but if lesion at geniculate ganglion will occur, then except all symptoms will be occurred. Another is lesion at after geniculate ganglion in stylomastoid foramen. Test will also absent because in the stylomastoid foramen, before that, through the inferior canaliculi, chorda tympani nerve supplies to the salivary gland and taste fiber also goes. So taste and salivation will be intact. So at this level, only Bell's palsy will continue. Bell's palsy will be continued, and in Bell's palsy there is asymmetry of face, loss of wrinkles in forehead, nasolabial folds will be negative. Along that, there will be oozing of saliva during eating, and swelling will be also affected. Along with it, there will be inability to close eyes. These are the symptoms of Bell's palsy. And another, there is crocodile tear syndrome. Crocodile tear syndrome occurs when lesion is proximal to geniculate ganglion, then fibers to salivary gland will be regenerated in the endoneurium sheath of greater petrosal nerve, and tearing will be occurred during eating. While eating, this is about crocodile tear syndrome. And another is facial nerve palsy in infant. What actually happened during this condition while delivery? During delivery, when we will move the head of baby, as there is a lack of development of mastoid process, so facial nerve, especially that special visceral efferent fibers below the stylomastoid foramen, is not protected by mastoid process. It is not protected by protection is absent, so it may get a lesion. So lesion of facial nerve is prominent due to movement of head. So there will occur Bell's palsy in the baby. This is about the clinical correlations of facial nerve and whole about the facial nerve. So I hope you have enjoyed this lecture, and please put out your comment if you like it.